Raise your hand if you have kids. I have three boys. My youngest is a girl. Whenever I'm out of town, speaking around the country as I've been for the last 8 days, every day she FaceTimes me and she says, "Daddy, are you coming home today?" And for the last 8 days, the answer's been, "No, Sophie, I'm sorry." So with a little help from you guys are going to give her the answer that she wants to hear. So on the count of 3, I want you to say, "Sophia, Daddy's coming home today." 1, 2, 3.
Sophia, Daddy's coming home today.
Awesome. Thank you. When I was a kid, my grandparents took me out to lunch. They're from Brooklyn, minutes from here at NASDAQ. Now, being from Brooklyn, sometimes the conversations had a bunch of 3 and 4 and 6-letter words that make a movie R-rated. But for them, we're just kind of like commas. And my pop, he wasn't a formally educated man, but he always taught us life lessons. Maybe you can help me with these. The first one was righty-tighty, lefty, measure twice, cut. And if you can't make it make common sense, you guys probably don't know this one, it can't be true. Matter of fact, being from Brooklyn, the first time I spoke at Harvard, he said, I was expecting a couple attaboys, pat on the back. He said, I guess the standards up there are getting a little bit lower. They'll let anybody in there now. At that lunch, the first thing my grandmother did is she put out 13 pills. And I'm like, "Bub, what all the pills for?" And she said, "Well, baby, the first one's for my sugar, the second one's for my pressure, the third one's for my cholesterol, the fourth one, baby, that's for the side effects of number 1, and the fifth one, that's for the side effects of number 2, and so on and so on." And I saw my grandmother's health go downhill very quickly. Oral medication after oral medication, insulin, dialysis, amputation, until a couple months after that lunch, she was up in heaven with all the angels. My name's Dr. Stephen Wonder, not like the singer Stevie Wonder. I promise not to sing for you tonight. I'm the international best-selling author of 6 books. My latest 3 are It's Not You, It's Your Thyroid, Finding a Wandering Mind, Help for the Alzheimer's Patients and Their Family, and the last one, in honor of my grandmother, Reverse Your Diabetes, Change Your Life. And over the last 20 years, I've helped literally over hundreds of thousands of patients become healthier. Now, the story I'm told by diabetics is never changing. You go to your doctor, the doctor does some blood work, you get a call a couple days later from the office, they say, "Hey, Mr. Jones, you need to come in, the doctor's seen your blood." So you make an appointment, you go back in, and the doctor says, "Hey, Mrs. Jones, we got your blood work. I'm sorry to inform you, you are a type 2 diabetic." And then they start to give you a medication that starts with M, ends with N, and sounds a whole lot like what? Metformin. And then you get these wonderful words of advice from your doctor. Change your diet, lose weight, exercise. Change your diet, lose weight, exercise. Change your diet, lose weight, exercise. With no mention of what possibly might you need to change your diet to, what type of exercise you would need to do, and how much weight do I have to lose. And typically, the person telling you that needs to lose 25 pounds themselves. And then you go down the line in the pill for an ill model is what I call it. So you start with the metformin, then your blood sugar starts to rise, your A1C starts to rise, and then you start with the G drugs, Glipizide, Glipizide, Actos, Januvia, Farxiga, Jardiance, Invokana. And then basically your doctor eventually says, "Listen, you didn't listen to my advice," waves his finger at you and says, "I'm going to have to put you on insulin." And that treatment is treating the smoke and not treating the fire. Where there's smoke, there's fire, and that's treating the smoke and not the fire. That model of care, the pill for an ill model, has made diabetes go from the 7th leading cause of death, now is the 3rd leading cause of death, and leads you to complications that it's not a question of if you will get them, but when. Heart attack, stroke, kidney failure, liver failure, amputation, and blindness. And I'm here to tell you that that is totally unnecessary because type 2 diabetes is a completely simple disease to reverse. It's not easy, but it's simple. But if we can properly test why you can't regulate your blood sugar, and I can assure you it's not the same for all of you, then we can build a customized plan from the ground up specifically for you. I mean, I know that sounds crazy, but that's how you do it. Unfortunately, that's not what's done. So type 2 diabetes is preventable, treatable, and reversible. And when we pick the right patient for our program, we have rarely seen a patient fail. And I've dedicated the last 20 years of my entire professional life to make sure that you and your kids and your grandparents don't suffer from this completely reversible disease.